So, Jesduvroq 8 mg tablet is a medication that is used to treat anemia in people with long-term serious kidney disease who are undergoing kidney dialysis. The tablet works by increasing a natural substance in your body called erythropoietin, which then signals the bone marrow to make more red blood cells. This helps to improve the red blood cell count in the body and treat anemia. It's important to take this medication as prescribed by your doctor and to follow their instructions for the best results. It's usually taken once a day, and the best time to take it may vary depending on your individual needs, so make sure to ask your doctor for guidance. Before starting daprodustat, make sure to read the medication guide provided by your pharmacist. And if you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily, with or without food. Swallow the tablets whole, and do not cut, crush, or chew them. The dosage of Jesduvroq 8 mg tablet erythropoiesis-stimulating agents is based on your medical condition, response to treatment, lab tests, and other medications you may be taking. Be sure to inform your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. To get the most benefit from this medication, use it regularly. Try to take it at the same time each day to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. If your symptoms do not improve or if they get worse, make sure to inform your doctor. If you experience abdominal pain while taking Jesduvroq 8 mg tablet erythropoiesis-stimulating agents, it's important to inform your doctor or pharmacist. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. Jesduvroq 8 mg tablet erythropoiesis-stimulating agents may cause an increase in blood pressure. It's important to monitor your blood pressure regularly and inform your doctor if the results are high. Your doctor may prescribe medication to control your blood pressure. Contact your doctor immediately if you experience any serious side effects, such as symptoms of heart failure or very serious side effects like seizures or symptoms of stomach/intestinal bleeding. Although it is rare, a very serious allergic reaction to this drug may occur. Contact medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you experience any other effects not listed here. In the US and Canada, you can contact your doctor for medical advice about side effects and report any side effects to the respective regulatory authorities. Daprodustat, also known as Jesduvroq 8 mg tablet, is a medication used to treat anemia caused by chronic kidney disease. It works by helping your body produce more red blood cells, which can help improve your energy levels and overall well-being. However, it's important to be aware of the potential risks associated with this medication. Daprodustat may increase your risk of developing blood clots, which can lead to serious and sometimes fatal complications such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. If you have a history of blood clots or heart/blood vessel disease, you may be at an increased risk of experiencing these complications. Therefore, it's crucial to use the lowest effective dose of this medication and to attend all of your scheduled lab appointments. Your doctor will need to monitor your red blood cell count and hemoglobin level closely to ensure your safety. If you experience any symptoms of a blood clot, such as shortness of breath, chest pain, unusual sweating, confusion, sudden dizziness, or sudden vision changes, seek medical help immediately. It's important to take this medication exactly as prescribed by your doctor and to follow their instructions carefully to minimize the risk of these serious complications. As for the daily dosage and optimal timing of taking this medication, it's best to follow your doctor's recommendations. They will be able to determine the appropriate dosage for your specific condition and advise you on the best time to take it for maximum effectiveness. Before taking Jesduvroq 8 mg tablet erythropoiesis-stimulating agents, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history, especially if you have a history of alcohol use, cancer, heart failure, high blood pressure, liver disease, smoking, or stomach/intestinal problems. If you are planning to have surgery, remember to inform your doctor or dentist about all the medications you are currently using. If you are pregnant, Jesduvroq 8 mg tablet erythropoiesis-stimulating agents should only be used if clearly needed, as it may harm an unborn baby. It is also uncertain whether this medication passes into breast milk, so it is not recommended to breastfeed while using this drug and for 1 week after the last dose. Don't forget to consult with your doctor before breastfeeding. When taking Jesduvroq 8 mg tablet, it's important to be aware of potential drug interactions that could affect its effectiveness or increase the risk of side effects. Make sure to keep a list of all the medications and herbal products you are using and discuss it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. It's also important to note that other medications can impact the removal of daprodustat from your body, which may in turn affect how Jesduvroq 8 mg tablet works. Examples of such medications include gemfibrozil, among others. Be sure to discuss any concerns about potential drug interactions with your healthcare provider. If you suspect an overdose or serious symptoms after taking Jesduvroq 8 mg tablet erythropoiesis-stimulating agents, it's important to seek immediate medical help. You can call 911 or a poison control center for assistance. U.S. residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center for guidance. It's crucial to act quickly in these situations to ensure proper care and treatment. When taking Jesduvroq 8 mg tablet erythropoiesis-stimulating agents, it's important to remember not to share this medication with others. Before starting and during the course of this medication, it's essential to undergo lab and/or medical tests such as a complete blood count, liver function, and blood pressure. It's crucial to keep all medical and lab appointments and consult your doctor for more details. Additionally, blood tests for iron levels will also be done, and you may be prescribed iron supplements. Your doctor may also recommend eating a well-balanced diet rich in iron sources such as raisins, figs, meat, eggs, vegetables, and iron-fortified cereals, so be sure to follow your doctor's instructions and dietary recommendations. If you forget to take a dose, take it as soon as you remember on the same day. If you don't remember until the next day, just skip the missed dose. Take the next dose at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Jesduvroq 8 mg tablet erythropoiesis-stimulating agents, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a secure place and out of reach from children and pets. When it's time to discard the medication, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to dispose of it when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.